Hi guys, it's Dr. John with Des Moines Spine+Sport and another Movement Monday piece. Today I want to talk to you about runner's knee. Alright, it's a knee pain issue that is so common with runners that it has its own name, runner's knee, otherwise known as patellofemoral pain syndrome. Alright, so what's going on in runner's knee is actually involving the kneecap and the femur, like patellofemoral pain syndrome suggests. So we're looking here at the picture. Here we have the kneecap that sits on top of the femur. And in this picture, you can see that it actually has a groove here that the kneecap rests in. What happens is the kneecap starts to track aberrantly or laterally, and it's not supposed to. It's supposed to track straight up and down. So as you can see, with an increased angle here in the femur, that's going to cause the kneecap to actually track laterally over top of the outside part of that groove. And that can rub the cartilage wrong on the back side of the kneecap, and it gets sore and raw. So what I want to show you is a couple exercises to help correct a mechanic that could be causing your knee pain when running. Alright, so first exercise that I want to show you is a wall sit with a ball squeeze, and that's going to strengthen the inside part of your quad or your VMO. Alright, so we're going to take this ball, we're going to get down to a nice 90-degree wall sit, and we're going to squeeze this ball between our thighs, and we're going to sit here about 30 seconds to a minute, basically as long as you can, okay? So this is activating the very inside part of our thighs, not only that VMO, but also a little adductor, and that's going to help correct the pull on that patella. Alright, the next exercise that you can do is called the monster walk. You can actually do it with a band as well. Here I'm going to do it without a band. If you had a band, you'd wrap the band around your ankles fairly tight, but what you're going to do is get down to that athletic position, alright, and then you're going to laterally step out, and then back in with the other foot, out and in, out and in. And you're going to repeat that for say 30 steps, rest, and repeat it again. What that's going to do is help strengthen your hip abductors, or this outside part of your glute. Alright, so a couple tips there to help you with your runner's knee. If you have any questions, feel free to give us a call. Des Moines Spine+Sport with your Movement Monday.